Good morning, good afternoon, good evening. Welcome to our second webinar on survivorship. Yesterday, more than 1,000 people from more than 70 countries had already registered, which is a clear sign not only of the importance of this topic for our community, but that many problems the survivors face are global. In fact, late effects on mental health are transversal issues wherever you live. It is important that each survivor that walks this path realizes that he or she are not alone. On the other side of the world, someone is facing similar challenges. This year, we decided to invite a parent and a sibling to share their experience as well, because we know that a childhood cancer diagnosis affects an entire family, and these too must be considered. I hope you find this webinar of value. I would like now to hand the microphone to Julia, who will be presenting the first panel. Julia?
Good morning, João. Would you like to introduce and share your history and your position here with the audience?
Well, my name is João, as you can see. I'm a bereaved father. I'm the current president of Childhood Cancer International. I'm also the president of Acreditar, which is the Portuguese Association of Children with Cancer. And it's a privilege to be co-hosting this webinar with our friends from SIOP with the fantastic help of St. Jude.
Thanks, João. It's a pleasure to be here today. My name is Julia Challenor. I'm a pediatric oncology nurse. I work at the University of California, San Francisco, and I am the Secretary General of the SIOP, which is International Society of Pediatric Oncology. I want to check with our tech. Brandy, did you want to show some housekeeping slides so people understand how they can share their questions?
You're not sharing those, Julia?
I can if you like.
Yes.
Well,
I think what I'm going to have to do is do it orally. So we welcome everyone who has a question to chat in the bottom of your, and thank goodness we've all been using Zoom, many of us for several months, multiple months over the last few years. At the bottom of your screen, you'll see Q&A, and we'd like you to click on that if you have a question. We have two moderators who will be looking for your questions and sharing them with us. We will not be able to have you tell us your questions, unfortunately, because we have short time, but we absolutely want to hear from you. We're going to run an introduction. This morning, we're going to start with two physicians who work with survivors, and they will make a short introduction of who they are, and then we will have them show a few slides and open the discussion with the audience about their work and questions you may have. So if you have a question, please put it in Q&A at the bottom. You will also be able to check the interpretation. It looks like a little globe at the bottom of your screen. And we have interpretation in Spanish and in Chinese. So please, if you would like to hear it in either Spanish or Chinese simultaneously, you will look on the globe at the bottom where it says interpretation and pick your language. It's now my great pleasure to introduce and put the video on of the introduction of Dr. Gauri Kapoor from India and Dr. David Noyd from the United States. Brandy, can you go ahead and run the videos?
Welcome, bienvenido. 欢迎
My name is Dr. David Noyd, and I'm a pediatric hematologist oncologist at Oklahoma Children's Hospital in Oklahoma City, Oklahoma. Thank you very much for the opportunity to participate in this survivorship webinar. My clinical work primarily focuses on caring for children with cancer during active treatment, as well as in our Taking on Life After Cancer clinic, which is our survivorship clinic. There has been tremendous progress in long-term survival for childhood cancer over the last several decades. However, cure often comes at a cost. We have learned a lot from adult survivors about the potential late effects from treatment. My research seeks to take what we have learned about who is at greatest risk for complications such as cardiovascular disease and use informatics and population health tools to engage and empower high-risk survivors so that they can go on to live long, happy, and healthy lives. I look forward to being part of the conversation today and learning together to improve the health of survivors across the globe.
Namaste. I am Dr. Gauri Kapoor, a pediatric oncologist in India. I am director of the program at Rajiv Gandhi Cancer Institute and Research Center, New Delhi. As you probably know, New Delhi is the capital of India. Recognizing the special needs of young patients, we have a dedicated department for children and adolescents up to 18 years of age. The department is supported by 8 doctors, which include 4 fellows. We have 21 nurses dedicated to pediatrics. We also have a playroom teacher and a child counselor. So, as you know, most children will overcome their cancers, but they need to continue to follow up regularly to monitor their health and future. So we too have a survivorship clinic. It's called ACT, or After Completion of Therapy Clinic, which runs on every Thursday and Saturday to monitor the well-being of our survivors. We do organize various social events to keep our survivors engaged with us and to ensure that they have their regular health checkups. So with this brief introduction, I welcome you to today's session and look forward to an interactive and enriching discussion with all of you. Namaste.
Thank you so much. It's now my pleasure to reintroduce Dr. David Noyd and ask David to share his slides and his opening presentation. David, over to you.
Good morning. Thank you so much, Julia. It's a pleasure to be here with you all, and thank you to all of our families, our survivors, our providers, and everyone who's been helping to put on this event today. I'll be talking about data and technology tools for use in health management and empowerment of survivors of childhood cancer at a population level.
David, can I just break in for 1 second? Could you
Yes, of course.
slow down your talking a little bit, because the Spanish is going to take longer than English. More words. Thanks.
Thank you, Julia. I appreciate that. We know that we've had great success in improving survival for children with cancer. However, we know that cure does come at a cost, and there are a lot of potential late effects from cancer treatment. We know that treatment can affect every major organ system in the body, potentially. We also know that the risk is different for different types of cancer and different types of treatment. Each survivor is going to have a different level of risk for each one of these late effects. And we also know that risk changes, and it often increases during adulthood, particularly that transition from childhood to adolescence to adult is a challenging time for many reasons. And the risk for late effects can go up as you enter your adult years. One of the goals for survivorship is to make sure that we enable survivors to live long, happy, and healthy lives after their treatment. To this end, there are numerous guideline-based approaches to survivorship-focused care. A number of different groups, such as the Children's Oncology Group and their long-term follow-up guidelines, PAN Care, and more recently, in the last 5 or 10 years, the International Guideline Harmonization Group has been a tremendous effort internationally to try to harmonize the guidelines from across the globe with the main goal of establishing a common vision and integrated strategy for the surveillance of chronic health problems of survivors, as well as subsequent cancers in childhood, adolescent, and young adult cancer survivors. So how do we take what we've learned? How do we collaborate together and deliver the best care possible for all survivors across the globe? This means that, what is this idea of surveillance? Essentially, it's being vigilant and taking action when we suspect that you may have a problem, and being aware of the potential problems that can happen. Major organ systems that can be involved, cardiac. So again, there's different cancers and different treatments can give you different risks for these late effects. Many of our survivors of leukemia, transplant, Hodgkin's, and other types of lymphoma. Major exposures include anthracyclines for chemotherapy, which is used in about 60% of regimens for child cancer, chest radiation, and guidelines vary as far as needing echocardiograms or getting an ultrasound of the heart every 2 years or every 5 years to pick up early signs of heart problems so that we can take action and prevent that from progressing to heart failure. We also look for early warning signs, asymptomatic problems with echoes, as well as counseling survivors if you have shortness of breath, if you have any early signs to give us a call. Secondary cancers is another major issue for survivors. For leukemia, secondary leukemia to treatment, early breast cancer for our young female survivors, colorectal cancer, skin cancer. We know that there are a number of different chemotherapies and radiation that can unfortunately lead to this later in life. We can try to catch this early through blood tests and earlier screening tests than are recommended for the general population. Fertility is also a major issue that I believe we'll talk more about today. Bone tumors, soft tissue sarcomas, germ cell tumors, neuroblastoma, being able to counsel survivors and their families and make early referrals to fertility specialists and provide resources for all survivors is very important. As well as mental health that we will dive more in depth and hear from many of our survivors later today, depression, anxiety. We can do screening tests, provide psychosocial support for our survivors across the continuum. My research focuses on informatics and population health. What is informatics? Informatics essentially is how do we take information, change it into data, and turn that into knowledge that can equip us to care better for survivors, not just individually, but also for the whole population of survivors. Much of my work is looking at how do we take data from sources such as the electronic health record, cancer registries, survivorship care tools such as Passport for Care, and geospatial data to better understand our survivorship population. And then out of these survivors, we know that there's going to be some survivors that are particularly high risk for late effects, and how do we identify those survivors and re-engage them and keep them engaged with their care to empower them to live long, happy, and healthy lives. This helps us to provide risk-based survivorship care for all of our survivors, identifying those who are at low risk for late effects and potentially could follow up with their primary care provider, those who are medium and high risk who maybe need a higher level of care and coordination with different subspecialists to provide optimal care for them. There are a number of informatics and technology tools that we can use to empower survivors and better equip our health systems to care for this population. Survivorship care plans with tools from the Children's Oncology Group, as well as Survivorship Passport in Europe, have made tremendous progress in providing these detailed plans for survivors. Mobile health tools can help with self-management and exercise interventions. Patient-reported outcomes help us to better capture the quality of life for survivors and how we can identify new needs and barriers to their care. And then the pandemic over the last couple of years has really taught us a lot about telehealth, as geography and distance can be a challenge both on treatment as well as off of treatment for distance to a tertiary care facility where you can see an oncologist or a subspecialist. So how can we use these tools to equip survivors, inform them, and to partner with them to deliver the best care so that they can grow up again to live long, happy, and healthy lives? I look forward very much to the conversation today. And again, thank you so much for inviting me to be part of this discussion today.
Thank you very much, Dr. Noid. I now invite Dr. Gauri Kapoor to share her presentation.
Are my slides visible? Are my slides
Perfect.
visible?
They're perfect, Dr. Gauri.
So namaste to everyone from India. And I can't advance my slides. Okay, good. So I bring you greetings from New Delhi, India, from the Rajiv Gandhi Cancer Institute, where I am a childhood cancer specialist. And I work in the capital city of Delhi. And ours is a 500-bedded hospital. You have heard all the technical details about how survivorship care is brought about today with all the science and all the technology coming into it, and how we as pediatric cancer doctors are so concerned that you as survivors may have healthy and happy lives in the future. This is our children's ward, and this is our team of nurses, our team of doctors and fellows. And also, this is a picture showing you that how important it is, not only for you as survivors, but for us also to celebrate survivorship. But remember that even after survivorship, we need to keep looking after our own health. And you as survivors are as important as us as physicians to be responsible for your future health. So we have what we call the survivorship clinic in our center as well. It's called the ACT, or after completion of therapy clinic, which is run on 2 days in a week. We've had this now for almost 5 or 6 years. And why is it important? It is important because survivorship is definitely accompanied, we know very well, by late or long-term effects of cancer treatment. Why is it late? It's late because many of you have received your treatments when you were very young, you were children, when your body was still developing. So these health problems may emerge many years, even 10, 20, 30, 40 years after the end of your cancer treatment. At that time, you may no longer be under our care as the pediatric oncologist. You may have moved ahead in life and you may be doing all the normal things people do. But if you know and are aware, have the knowledge of what late effects may happen, then you know what to monitor for, and you know how to make sure that you can anticipate and detect these problems early, how you can seek treatment for these. So what do we do at these clinics? So you have seen that for each child, depending on what the tumor was or what the leukemia was and what treatment you received, there is a scientific way to determine what kind of late effects you might have. And based on that, we make an end of treatment summary for you. However, all the children would require certain annual checkups after 4 or 5 years of diagnosis. That means at least you are 2 to 5 years of therapy, you're doing well, you look like you don't need any checkups, but science has clearly shown that you need a once-a-year checkup with a physician or a pediatrician. It may not be a cancer doctor, but it will be focused to your needs. It will be focused to what kind of treatment you received during your cancer therapy. So one of these is, if you have a problem list, you must discuss it with your physician. Then we do a thorough head-to-toe examination to look for any abnormalities. We, at least for the children less than 18 years, would monitor growth and development to make sure that you're growing as fast and you're gaining your weight and your height as you should, that you're not getting obese, that you're having your sexual development, pubertal development at the time and at the rate that you should. Also, whether you're able to keep up with your scholastic or school performance, and that all your immunizations are up to date. Then we have, so the pediatrician can very well do all of this. It is not very specialized, but we need to do it. Because this is a little growth chart here that you see, in which we record your weight, and here we record your height. And if at any time we think that you are falling off the curve, then we do a battery of tests. Because not every child will have all the complications that are listed. Most of you will have certain problems depending on your treatment that you had, right? So it is really important that we maintain your growth chart. The other thing is your vaccination immunization, which your oncologist will probably list, but which you can take it with your GP at your town, wherever you are. Then the most important thing and the most preventable thing is your behavior modification, the lifestyle counseling as we call it. So watch your weight, make sure you're not overweight, because many of the problems like diabetes and hypertension come with obesity. So you want to make sure that you're maintaining your weight in the normal range, that you are doing your 30 to 60 minutes of regular exercise, that your diet is healthy, you're not snacking junk all the time, occasionally is all right, that you're not totally, absolutely not taking any tobacco product, and are not indulging in unsafe sex. Each child will have an end of treatment summary based on which certain specialized tests will be advised to you depending on which organ or system is at risk, and where we want to make sure, for example, somebody who got anthracycline, as you saw in Dr. David's slides, would need 2 to 5 yearly cardiac checkups with echoes, ECGs, etc. Somebody who had a drug like bleomycin would require frequent pulmonary function tests, and would also need to know that they absolutely need to avoid smoking. And they also absolutely need to be sure that if they go in for surgery, they must tell their doctor that they had bleomycin, so that high oxygens may be avoided for these patients. So also there are other drugs like cisplatin, ifosfamide, etc., which have their own unique late side effects, which we discuss with you individually, right? So as physicians, as pediatric oncologists, we want all of you survivors to not just be cured of your cancer, but to be cured as a child, as a person. And as pediatric oncology, we emphasize that not only are you cured of the disease, but you're on par with your peers in growth and development physically, and in achievements and aspirations, both mentally and emotionally. And we want you all to have your dreams and achieve your dreams. But for that, you need to make sure that you have your annual checkups and do all the tests as advised. That's not so difficult. So if I summarize once again, my health tips to all my survivors: don't be overwhelmed, don't be afraid. Everybody gets, many people, at least in my part of the world, 4 out of 10 will have diabetes and hypertension. That doesn't mean everybody worries about it. But if you monitor for your side effects, your late effects, then you will lead a healthier and a longer life. So avoid unnecessary treatments. Be healthy in your choice of foods. Have a wide variety of these foods. Absolutely no alcohol. Be physically active for 20 to 30 minutes most days of the week. Maintain a healthy weight. Use alcohol in moderation. Avoid substance abuse. Take measure. Don't unnecessarily do activities which will cause accidents. And wear your sunscreen protection at all times, avoiding unnecessary sun exposure. So with all of these, you will improve your quality of life and you will prevent any premature complications. I want to share with you this newsletter, which is made by our group of survivors. So we have a very vibrant group of survivors, and they have webinars and physical meetings frequently. And this is one of their newsletters, which was done on Childhood Cancer Day, International Childhood Cancer Day. And as you can see, they are very, very active in doing and spreading awareness about late effects. So with these few of my slides, I welcome you to ask clarify some of your questions. And I look forward to having a very interactive session with you. Thank you. And I thank SIOP, Julia, CCI, Joe, and his team for inviting me to participate in this very exciting event. Thank you.
Thank you so much, Dr. Gowri. Let me double check now with Alejandra. Do we have any questions from the audience yet?
Yes.
Or Benson? Okay.
Yes. There's a question for Dr. Noy. It says that, does the cost of surveillance impact the ability to detect or predict late effects? Is this care covered by insurance?
Thank you very much for that important question. Cost-conscious care is very important to make sure that these services are available for everyone. And as we have more and more survivors, there's not always enough providers to see everyone. So I think they're twofold. One is identifying those who are at greatest risk to make sure that they are getting what they need. And two is to think about different models of care. Sometimes that means coming back to a survivorship focused clinic with an oncologist. Sometimes that can be a primary care provider that's working in partnership. Sometimes that is working with our advanced practice providers, nurse educators. There's a variety of models of care for different countries and different resource settings. And as far as insurance, I think that's very important to show evidence that, these are the tests that we really need to argue that in the long term, if we're working on preventive measures, we can really avoid a lot of these more expensive treatments later on. So I think from a cost standpoint, that's really important to show that, and also being thoughtful and in the services we're providing to each of our survivors equitably.
Thank you, Dr. Noy. Benson, do you have any questions?
I have a question, Julia.
Okay.
It says, childhood cancer is something that affects not only the child, but the whole family. For survivors' care, how can care encompass the whole family as well? What counsel is given to family members regarding the effect that a traumatic journey like this has on the body and mind of parents and siblings?
Dr. Gori, do you want to take that one?
Sure. So you're absolutely right. Childhood cancer is not an individual disease. It's a total family that is involved. The siblings, the parents, and I think even grandparents and other, in countries like ours, where we have joint families, the entire, the entire joint family is actually involved and traumatized. So for this, during the treatment, we often have counseling for families and for siblings. And after treatment, when we have our survivorship, so I may tell you that, once the treatment is over, the children are cured, everybody thinks that this is it. I have overcome this huge, big disease, and I don't need any more treatment. But actually, that trauma stays with them for many years. And for that purpose, we have a full-time counselor present during both our clinic days, who are there not only to counsel the children, but also their siblings and their parents. So in fact, parent counseling is part of child cancer counseling or child cancer survivor counseling. So this is very true. And I'm really happy you brought up this issue, because it is important for us to accept this, to realize this, to be aware of it.
Thank you so much. We're at the top of the hour. We are hoping that Dr. Noy and Dr. Kapoor can stay with us through the round table if possible. So if you have other questions, it's possible they come up in the next hour. But I'm going to now shift, and I'm going to introduce to you, we have Dr. Alma Benito, who is a pediatric oncologist from Mexico, and Dr. Pernille Bilstrup from Denmark. And we're going to run their videos of introduction, and then they too will have a short presentation and take questions after. Brandy and Amaya, can you show the videos of introduction? Please, thanks.
Hi everyone, my name is Alma Benito. I'm pediatric oncologist in Centro Médico Nacional 20 de Noviembre in Mexico City. I'm the leadership of Cancer Survivors Clinic, the first multidisciplinary and interdisciplinary group for childhood cancer survivors in my country. In this group, we are trying to reinsert the patients to the society with respect and dignity in order to get the best quality of life for them. We really believe in cancer cure, and cancer survivors are an special and growing population around the world. So I think we need to speak about them, we need to learn about them, and we must to help them to face cancer sequels. So I am really grateful for the invitation to participate in this international webinar. Thank you.
Hi, my name is Pernille Bilstrup, and I'm located here in Copenhagen, the capital city in Denmark. I was originally trained as a psychologist, but I've always worked in research. And today I work at the Danish Cancer Society Research Center. Each year, around 200 children are diagnosed with cancer, and between 1/3 and half of them are treated here at Rigshospitalet, the main hospital in Denmark. I know this hospital very well for several reasons. I've done a number of research projects together with the great clinicians here. One of the most important projects to me was where we tested therapy for families of children after end of treatment with cancer. We did the study in collaboration with all the 4 pediatric cancer clinics in Denmark, and we did find that the therapy was able to reduce the psychological symptoms in the parents. I know this hospital also for another and more difficult reason. So halfway through my career and halfway through the famous project, my youngest son was diagnosed with leukemia when he was 2 years old. Fortunately, he's doing fantastic today, but of course this impacted me as a person, and it also impacted my research. I'm even more eager and ambitious to do research that may impact the lives of families of children with cancer today.
Wonderful. So now you've been introduced to our 2 next speakers. I invite Dr. Alma to share her slides.
Can you see my slides?
Yes, can you put it? Perfect. Go ahead.
Thank you very much. Thank you very much, Julia, Yao, Alejandra. Thank you for the invitation. It's a pleasure to be here. I would like to start with these things. Cancer is the cause of death in children, as you know, but in Mexico, the story is a little bit sad because in our country, about 65% of the cases, cancer cases, arrive to the hospital in advanced stages. So we have to think how to improve that survival, that evolution, and we have to think how to treat cancer survivors in the same time. So we have 3 important institutions in Mexico to treat cancer survivors. One of them is Institute of Security for state workers. My institution, we treat about 11% of Mexican population. This is my hospital. This is Medical National Center 20 de Noviembre. We are a national reference center, and we attend patients from 32 towns from Mexico. We are here in the town, and we receive patients from very far states, very far towns. So when patients arrive to our hospital, they have to leave family, they have to leave friends, and the school too. We have pediatric, about 7 cases per year of cancer cases, and we have a global survivors of 60%. That is a really big challenge in our country, but we have to work. We are working in that. So that because of this situation, I think mental health problems begin when cancer diagnosis begins. Because of when the patients have to live all these things, they start to suffer. They suffer because of the cancer diagnosis. They suffer because of all changes in their lives. As you know, in the United States and Europe, 1 of each 600 young adults, they are childhood cancer survivors. We know that, but in Mexico, in my country, we really don't know how many childhood cancer survivors we have. That's why in 2016, we create the first cancer survivors clinic in Mexico. It was a necessity, a big necessity, because cancer survivors is a topic that so many people don't know about it. What does we need? First, a lot of enthusiasm to join a big team, big team, in where more than 40 pediatric and adulthood specialties. Oh, sorry. More than 40 pediatric and adulthood specialties we are working joint. But in our country, as I told you, so many people don't know nothing about cancer survivors. So we have to learn a lot of things about survivors' needs, and we have to join with people who are working with that kind of patients for a long time. And the fourth step, we need to look for a space to attend cancer survivors. And this is the medical office of Cancer Survivors Clinic. We need a space where and specific hours to attend this population. We attend the cancer survivors patients in afternoon every day and weekends too, with the work of Dr. Ruben Sebastian, pediatric oncologist. He attend on weekends and me attend during the week in order to avoid cancer survivors stop or leave their activities in academic activities or work activities. So they came to the consult without to stop their activities. Until now, we have 240 cancer survivors patients registered, and the principal age group is adolescents. This is a special group with specific necessities because they have to face a lot of problems overall in the insurance, health insurance. The main diagnosis of our survivors are brain tumors, lymphomas, and sarcomas. All these diagnoses have in common that they need aggressive cancer treatments, and aggressive cancer treatments increase the risk of mental health problems. Fortunately, our patients are doing things that all people in this age are doing. For example, most of them are reintegrated to elementary school and others in high school, and we have 21% of our patients studying at university. Unfortunately, we have 7% of patients that they are not studying, they are not working, and this is because maybe they are face neurocognitive problems, and maybe they lose eyes or limbs during the cancer treatment, and the schools are not ready to solve these specific necessities of this population. So we have to do some change in order to solve these necessities and include their patients and reintegrate in the schools the patients with necessities, with the specific necessities. But this is the main sequels of our patients. The main sequel in our population is physical sequels like loss of limbs, spasticity, for example, scoliosis, and others. The second main sequel is metabolical and hormonal sequels. They need treatment, endocrinologic treatment. And the third is psychological sequels. What's the principle? The main psychological problems. First, anxiety. This is the most common in our patients. Sleep disorders, depression, fear to die, fear to cancer recurrence, and fear to get another cancer, a second cancer. We have patients with difficulty relating to others. We have some patients with substance abuse. We have 2 cases of suicide attempt, and we have some patients that they suffered intimate partner violence. But they have another worries about, and most of them have concerns about their fertility, economical concerns, and they have concerns about their health insurance, most of them. How we could detect these problems? Well, we need to create an comfortable and trustable environment in order to get this information, and then we have to send the patient with a mental health team. This is part of the mental health team in my hospital. The leadership is Lucia Ledesma. She received our patients, and they all day treat our patients in an excellent way. So our patients now, all of them are in treatment, but we have a lot of changes yet. For example, in Mexico, society undervalues the participation of cancer survivors in the school or work. They suffer discrimination. They suffer. They are sometimes rejected from school or from some employers.
Excuse me, Dr. Alma. Sorry, we're running a little late. Could you go to your proposals for solution?
Yes,
Thank you.
I think we need to create campaigns where the survivors can, where we can to speak about the abilities and talk about more over this incredible population. We need to create a kind of call center where they can consult an expert who can help and guide them all the time, in all the days, all the hours. And we need to detect and treat mental health problems really early.
I think go ahead.
They are some of my patients. They are part of my team. And this is a team of survivors, cancer survivors from another hospitals. And you know, this is powerful energy when they are joined. And this is the cardex of my patients that include all the follow they needs. We need the help of society. We need the help of services, both services and the directors of the hospitals, in order to speak more about cancer survivors. Thank you very much. It's a pleasure to be here.
Thank you, Dr. Alma. Really appreciate your view from Mexico. I now turn the microphone over to Dr. Pernilla to share with us her experience from Denmark.
Thank you so much. Can you see my slides?
Yes, perfectly. Thanks.
Thank you. So thank you so much for the invitation and for arranging this webinar to ICC and SIOP and Julian Chow.
I'm going to talk a bit about how can we return to normal life after childhood cancer. So as we have heard, and most of you probably know, childhood cancer is a stressful life event. And some of the psychological stress is due to the medical procedures during the treatment, but there are also issues related to being isolated and not having contact to family and friends due to protection from infections. And of course, having a threatening disease, life-threatening disease can cause a lot of distress as well. We don't talk too much about how young children express their emotions, but actually it's often a little bit different from in adults. Children may withdraw from social interactions and they may feel unease. A lot of them may express emotions by bodily reactions. So tummy aches and headaches may actually be expressions of emotion as well. And some children also even express anger due to the psychological distress. It's so important to underline, and it's already been heard today, that cancer not only affects the patient, but the whole family, the patient, the parents, and the siblings as well. And it's also really, really important to acknowledge that when treatment is over, it's often not over for the families. A lot of families experience that they're not happy and back to normal when the treatment has ended. And this is illustrated to the left, where we have the roadmap to the cancer journey. So the cancer treatment is often a long and bumpy road where you have detours and bumps along the way. And when you reach to the right, to the end goal of treatment, you might not feel that your mind is there. And it may also be a bit confusing in the family if some family members feel, well, I'm happy and relieved that we are through treatment, but the other family members might be on a detour and still very afraid of, for example, the cancer coming back. So how do we cope with cancer in the family? We've actually changed our perception of coping. Before, we thought a lot about going through different phases and in a specific order. But now coping is actually thought of in a very different way. So when we cope with stress and cancer, we often change between different tracks. We change between the disease track and an everyday life track. When you're in the disease track, you have your thoughts and emotions and your focus on understanding and living with the disease. And you may be very preoccupied with the disease. But in the other track, in the everyday life track, you can have your thoughts and emotion on everyday life. You can go to work and school and be preoccupied with everyday life activities, and maybe even go to a football match and have fun for a couple of hours. So I think it's important to be aware that this is actually normal coping to go between these two tracks. And it's actually healthy to be able to change between them. And children and younger children may go back and forth between these two tracks even many times a day. And it can be very confusing to others and to the surroundings that maybe going to work is a possibility when you have a child that's very sick, but that's actually very normal and healthy. So when we have to be careful is when you're stuck in one track and you're only preoccupied with the disease for all the time, and you can't engage in every life track or the other way around. So we already heard a bit about the common psychological issues in children after cancer, but I think I also want to mention fatigue. And of course, that's a physical issue, being very tired and exhausted, but it's also an emotional issue, being exhausted emotionally. And also a lot of adolescents especially report that they feel different from their peers and that they feel very alone. But fortunately, the severe long-term psychological late effects in children are actually not that common. And fortunately, around 80 to 90% do not have severe psychological late effects. And I think that's really important. But of course, we do need to take more care
of those who do experience psychological issues, such as anxiety, depression, and post-traumatic stress. A lot of issues are also related to cognitive difficulties, and that's especially in children who had radiation therapy and children with CNS tumors. I think it's important to also underline that some families report positive changes, but still it's important to not put this as a pressure that you're supposed to be experiences a lot of growth and existential growth after a childhood cancer. Some may experience that, but it's not a pressure. In terms of time, I'll just mention a couple of examples of what you can do if experiencing some specific problems. And if feeling alone or feeling different as an adolescent, I think it's important to adjust your expectations to yourself and maybe find a few selected friends who you can trust and who you can get a good connection with. And then also seeking out support groups can be very helpful for a lot of adolescents. In terms of fear recurrence, I think checking with your doctor is important. Some people experience that they're so afraid of fear recurrence that they keep monitoring themselves. And actually, that's not always very helpful. So it's good to question your behavior. What do I gain from worrying all the time? Is that worth it? But of course, you have to check with your doctor and ask them when should I monitor my body and when should I check my body? And maybe once a week could be okay. And then you can relax more the rest of the time. I also just want to mention depression. And I think for depression, it's really important to check in with your doctor if you feel signs of depression, because there is medication and therapy that can help you. And also physical activity can be really helpful for a lot of the psychological symptoms. So how and should we even talk about emotions in the family? I think we're seeing actually quite a big change right now. Earlier on, we were very focused on protecting children by not informing them too much about the cancer, not informing them too much about treatment and the prognosis. But now we see a change towards actually including children and informing them more about the treatment and care. And I think that's also true about the psychological and emotional issues. So if you do want to talk about emotions with your child and talk about the disease and treatment, I think it's a good start to always start with asking the child about what they know, because that can really guide you towards where they are and what information you should provide, because you should always adapt this to the individual child. You can ask the child permission. So do you want to know about this? Do you want me to tell you about this? And you can also ask afterwards what the child really understood from your talk, and maybe adjust them a little bit if they have misunderstandings. So I think emotions is really complex to talk about in the family, and even more for children who may not know about all the emotions. But questions like, how do I feel? What do I say? How does it feel in my body? What do I do when I feel this? What helps me when I feel this? And also, are there alternatives, ways of reacting to my feelings? Could be questions that could be talked about in the family. So my question in the beginning was, how do I return to a normal life? Maybe that's not the right question, because the coping with cancer is a really long-term journey and process where you have going back and forth between the disease track and the everyday life track for a really long time. So maybe a better question is, how can I adjust to my new life in a good speed? So just a few general suggestions here at the end. I think getting information and being informed about what are the late effects of childhood cancer is a very good start. And of course, your doctor is important. Sharing thoughts within your family about the cancer and about where you are as a family can be really helpful for many families. And also, I think it's important to balance. Be patient with yourself. Of course, you have to push yourself
towards being better in managing your disease and your life after cancer. But you also have to be patient with yourself and accept the new normal and adjust your expectations. I think when relevant, professional support can be really, really helpful. And we have worked with that in my research in Denmark. And we have developed a new therapy program for children and their families after end of treatment. And that's available in Denmark by the Danish Childhood Cancer Foundation. And in Danish, we also have some good brochures talking about how does the life after cancer look like for the adolescent and also for the family. And those were the words. Thank you so much.
Thank you very much, Dr. Pernilla, for sharing your experience. I wonder, Alejandra or Benson, do you have any questions from the audience?
Yes, there are a number of questions from the audience, actually. So I would just read the first one. What is the biggest challenge in educating adolescents with childhood cancer on late effects, especially in the transition to self-management of their health status?
Excuse me, Dr. Pernilla, can you stop sharing your screen? Oh, perfect. Dr. Pernilla, do you want to take that question?
Yes, sorry about that. I was focused on de-sharing. Could you?
That's okay. Can you
Okay.
ask again on Alejandra, maybe a little shorter?
Okay, so what is the biggest challenge in educating adolescents with childhood cancer survivors on late effects, especially on the transition to self-management of their health status?
I think there are a lot of challenges, I think we need to be better at informing the families about what they can expect after the cancer, and that should be done very early on, because that will make the adaptation much easier.
Thank you so much. Do you have a quick question for Dr. Alma, maybe Alejandra?
There's a question here from Kathy Pritchard-Jones. She's asking, do you think it's a good idea for survivors to draft their own follow-up plan using publicly available guidelines, at least to provoke a discussion if they haven't been offered a plan?
Dr. Alma, you're muted. Can you turn on your microphone? Thanks.
So sorry. Yes. Oh, unfortunately, in Mexico, we don't have that kind of guides, but we are working to create it. But some countries, they have that kind of guides. For example, CCG have an important group of material for people, and it is available for all people. And I think it is necessary to learn how the patients have to continue the follow in this work in this country, in this city, and not abandon never this follow. That is important. They learn it.
So if the guide is not available in your country or in your language, it's important to check with the professional, you're saying, so that they can get the accurate advice on how to do follow-up?
Yes, of course, we are working in that. It's very hard work and it's a challenge, but we are to do it.
Thank you very much. I thank both Dr. Pernilla and Dr. Alma. Because of time, I wish we had a whole hour more for discussion, but I don't want to take any time away from our roundtable. So I appreciate your presentations and your thoughtful comments. I turn the microphone over now to Matt Birch, who will be the moderator for the roundtable. We have survivors, a parent and a sibling, and Matt, over to you.
Just check I've taken it off mute. Thank you, Julie. I really appreciate that. So it's been my absolute privilege to be asked to moderate the roundtable. Thank you to the professionals and clinicians who have spoken before. We now intend to move to a section where we're talking to experts by experience. So we've heard a lot about the treatment, the pathways, the interventions that are available. Now we want to turn to the voices of people who have experienced that personally. And to do this, we're framing 3 questions. We have 4 survivors, we have a sibling, and we have a parent. And we're asking them to respond to these questions to frame how this works. So without any further ado, again, if you're listening and you'd like to ask a question, can we ask you use the Q&A button at the bottom of your screen? Put that up. Alejandra is helping me in keeping an eye on that. And with the restrictions on time that we have, we will answer any questions we can. If we can't ask them here, we'll answer them as we go along later on. So they will all receive an answer. So without any further ado, I'm going to ask my first question and then start drawing on.
Excuse me, Matt.
Yes.
Could we run the introduction video so everybody?
Oh yes, of course. Thank you, Julia, for saving me from that. Yes, if you could run the introduction video so people could realize who it is. Thank you.
Hi everyone, I'm Pablo Lac. I'm 23 years old and I'm from Chile. I'm also a childhood cancer survivor. I was diagnosed with a clear cell sarcoma in the year 2001. Through my childhood, I relapsed 3 times. Nowadays, I study psychology and I'm a member of the group Faros de Vida from Latin America. I'm founder of a Chilean group of survivors called Luz de Esperanza, and I'm very happy to be with all of you today. See ya.
Hi everyone, my name is Aprita. I am 32 years old. I'm from Indonesia. I was diagnosed with leukemia when I was 9 months old, and now I've been working as a corporate lawyer in a law firm in Indonesia since 2011. So it's been a good 11 years. And I also run a small business with my husband and my best friend. It's a farm stay business located at Sukabumi, West Java, Indonesia. And I also chair a survivors community in Indonesia called Cancer Buster Community, or CBC, which is under the umbrella of Yayasan Oncology Anak Indonesia, or YOAI. And in my spare time, I'd like to do yoga, listening to music, watching some good movies, and I've also been learning Japanese language for 1.5 years.
Hi everyone, my name is Sydney Chahonyo from Nairobi, Kenya. I'm 38 years old. Nairobi is a Maasai word that means place of cool waters. We are also known as the city in the sun, and the only capital city in the world that has a national park within it. At the age of 19, I was diagnosed with cancer of the postnasal space, and I did my chemotherapy and radiotherapy here in Kenya. And this last November, I celebrated 17 years of being cancer-free. I'm currently the board chair of Hope for Cancer Kids, a non-profit organization that raises funds to support children and adolescents from low-income backgrounds that cannot afford cancer treatment. At the moment, we treat about 150 children on a monthly basis. I'm also a member of the African Regional Committee for Childhood Cancer International. Today, I'll be speaking about my survivorship experience, some of the challenges I faced, and some of the things that got me through it. Thank you.
Hello everybody, my name is Tiago Costa. I am 27 years old and I am from Portugal. I am a childhood cancer survivor. I had a leukemia with 10 months old, and right now I am a young patient advocate for Acreditar, that is a parents organization for children with cancer in Portugal, and also I am a committee member of Childhood Cancer International Europe.
Who was diagnosed of retinoblastoma in 2018. He went through surgeries, chemotherapies, and radiotherapies. By the grace of God, today he is one of the survivors of cancer.
You looked past my sin, my guilt, my shame, and poured your love. Father, you left me every day and night. You they bless me on a regular day, on a regular day, on a regular day. Nyafo, nyafo. You they bless me on a regular day, on a regular day.
National Stadium, Surulere, Lagos. I am a cancer survivor. Thank you for having me here.
My name is Ifeanyi Odo. This is my son, Perfect, who was diagnosed with retinoblastoma in 2018. He went through surgeries, chemotherapies, and radiotherapies. By the grace of God, today he is one of the survivors of cancer in the world. We return glory to God Almighty. We also say thank you to Childhood Cancer International for counting us worthy to be here. It is a rare privilege to be here. Thank you so much.
Hello, Lozida from Lebanon. I'm 28 years old. I work in the finance department of a local NGO. I'm a twin sister of a survivor. My brother was diagnosed with cancer in 2005, and now he is very good. I'm his supportive. Thank you.
Perfect. Thank you very much for those introductory videos, everyone. So let us kick off and start with our first question. So our first question is, what were the challenges and really the kind of the knockback impacts from your experience? And I'd like to come to Tiago first, if that would be okay.
Hello, everybody. Thank you, Matt. So as I can tell you that as I felt ill at a very early stage in my life, so the first impact was for my family, not only the psychological impact since the day that the doctor said to my mother and my parents that I had a cancer, but also all the economic burdens and expenses that were added to the financial budget of my family during all the disease, as what happens to many families that has the children has cancer, and some of them are not near the cancer treatments, and this is a lot of expenses as well to go there. Some years after the disease, and when I started to realize that I had the cancer before, and I started to realize that I had some growing problems and issues, and that the other kids were growing up better than me, and I started to go to most consultations, follow-up consultations. Then some other years later, I started to ask some questions. So am I a survivor? And what now? What do I know? What do I really know about my disease? And nowadays, I can ask other type of questions, like, will I be able to have a family in the future, to have a child? Am I fertile or not? And will I am able to get a house? Will I be able to get a credit insurance or not without being discriminated? And for these questions, to answer to these questions, it was very important to have not only follow-up consultation that I have here in Lisbon, that is very important to me to do the annual checkout, and other follow-up consultations that I have. Fortunately, I have the opportunity to have, because I know that in very different regions of Europe and in European countries, there is not the same situation, and they don't have this kind of consultations everywhere. And also, it was very important to me to join the survivors group here in Portugal of Acreditar, because the experiences that we heard of all other survivors give us the chance to advocate for the challenges that we have in the future after the disease.
Tiago, thank you so much for that. Really appreciate it. Sabrita, the same question to yourself.
Hi, everyone. Thank you, Matt. So I guess same as Tiago, my situation is that I was diagnosed very early. I was only 9 months old, and I don't remember at all. Like I didn't experience, and I don't know what it feels like to, about all the treatment and all the ups and downs during the medication and all of that. I didn't experience that. And so I didn't even realize that I had cancer until perhaps when I was in the elementary school. And that's because my mother established this foundation for childhood cancer. And they held a lot of activities, a lot of events. And then someone approached me and asked how it feels like, how it feels like to be a survivor. And then I realized, oh, so I'm a cancer survivor. I think I was only like in the 6th grade, I think. And I guess because I did not realize, I didn't really encounter, I didn't really encounter any, like problems in my social life or in the school, because I feel like I was completely normal. Nothing is different from me. And by the time after I knew that I used to have cancer, I didn't really find any problems yet because I was so small, and what I thought was, okay, I survived and I'm gonna be fine. Oh, thank God I'm survived, so I'm gonna be fine. But then I participated in some events for cancer survivors, and from that I learned about late effect, and then I learned about other people's problems, especially those who experience themselves during the treatment. I realized that, wow, people face these difficulties because they knew how it felt like when they were when they were treated in the treatment. So then I decided to establish this survivors community, and from that I realized that perhaps the main difficulties that survivors face is insecurities about themselves. And that is also actually, I actually also experienced that, the insecurities, like Tiago mentioned, whether I can, what can I do in my life, whether I can pay, whether I can have a good work, and then whether I can buy a house and everything, and health insurance as well. And honestly, health insurance is I think the one problem that I just encountered, because I just applied for a health insurance and rejected.
Yeah.
So yeah. And anyway, I think what I can say is my one issue that I face is during my teenage year, I felt like my parents were very protective.
Mm-hmm.
Well, I really wish that I could explore more, and yeah, because that's what teenagers want, right?
Yeah.
They want to explore the social life and to get to know her friends, and then want to do the night outs and everything. But so at that time, I couldn't understand like why my parents are so protective. But as I grow up, I understand like, oh, okay, so that's why. But so what my parents did was they made some kind of rules, like I can play with my friends, but there should be a time limit for me to go home and stuff like that. If I already spent one night until late, then I should take a rest for another week to not go out, stuff like that. So, and it worked.
That's great. Thank you, Saprita. Thank you. That's lovely. Thank you so much. Sydney, I'd like to come to you. So the same question. What for you were the main challenges and obstacles you faced?
Thank you, Matt. And it's an honor to be here. And I think I'm going to deal more with the mental side of things, because aside from going through the treatment and the medical part of it, cancer is a very mental disease. And while I was going through it, I realized that I had to control the mental aspect of it. I had to have a strong mental resolve. And from the get-go, I told myself, I'm going to beat this. And I'm going to try every day to do the best to, get through this day. So even when I was having my bad days, and I realized that the days I was, feeling down and questioning myself and, having long conversations with God and, the why me, and you fall into that pity party, you actually have much worse days. But then we decide, I'm going to get through this. I'm going to do it. We're going to do this treatment. I'm not feeling so well, but, tomorrow is another day. Let me just get through today and, move on to tomorrow. Cancer is also it's a very lonely disease. Because as much as you have your family, your friends around you, they don't quite understand what you're going through. And I keep saying, even a doctor doesn't know when he says on a scale of 1 to 10, how bad is the pain? He doesn't know what 1 means. He doesn't know what 10 feels like. So you just kind of have to keep reminding yourself that mentally you need to get this. And you're also isolated from your friends. You're out of school. And, you see people's lives moving on and it's like, why is my life stopped and everyone else's life is going on? And, you long for that, especially at the age of 19, you long for that belonging. You want to be a part of something. You want to be a part of a group. And I think one of the things that helped me cope is that I had a strong support system. My family was there for me. Yes, I lost a lot of friends because a lot of them maybe didn't understand what I was going through. And maybe a lot of them were not, really my true friends. But then I also got to realize who my true friends are. And I decided to start focusing more on those relationships. There's also the fear of recurrence. And, doing the yearly checks, is it ever going to come back? And every time, you go and you get that blood work done, there's something in the back of you that kind of tells, this might, it might come back. So you also have to deal with that mental aspect of it. On the medical perspective, one of the long-term effects I have is that I have to wear hearing aids because my chemotherapy drug and the radiation that my ears were exposed to damaged my hearing, and they say in the long run my hearing is just gonna deteriorate and deteriorate. But as much as all these are challenges, I mean, my one thing that I can say that helped me get through it is you realize that you get to a point where you realize a lot of these things are not in my control. There's not much I can do about, whether my hearing gets worse or whether it doesn't get worse. There's not much I can do about whether the cancer comes back or it doesn't. But what I can do is worry about things that are in my control. Because when you're worrying about all these things and there's, not much you can do about them, then, you end up just getting depressed and upset. And I just resolved to say, you know what, I'm just gonna get up every day and do what I need to do today and make the best out of it. That's it for me.
Thank you, Sydney. That's wonderful. I just want to ask you a little follow-up question. You talked about friends pulling away from you. I was wondering, do you think that's a common experience? Do you think people are not scared, but unequipped to talk to someone who has cancer because they don't know whether to say the right thing or the wrong thing, or why do you think that happens at all, Sydney?
I think that does happen. A lot of people later on would tell me, I didn't call because I didn't know what to tell you. I didn't know what to say. I didn't know how to approach you. I didn't want to say something that was going to upset you. And other people just, they're like, okay, let him get through it. Let him get through his treatment. Then we'll go, see him afterwards and see how he's doing. So a lot of people really don't know how to deal with someone who has cancer. And a lot of the time they kind of step back and let you kind of walk through the journey without realizing that they're actually isolating you.
Yeah. And so you feel people are drawn away from you as if cancer is some sort of repelling thing, and that increases isolation, and that you think might be, is that a common experience, do you think, for people?
I think it is. I think a lot of us survivors, once you find a support group, you realize, now I belong. These are people who have gone through similar things. And that's one of the things that helped me, meeting other cancer survivors who have gone through things, and you start realizing, I wasn't alone in all this. But a lot of the people who didn't understand it, I think a lot of the people I know and survivors that I know actually lost a lot of friends going through this. So it is quite a common thing.
Sydney, thank you so much. If I can now turn to Pablo and ask you the same question, Pablo, what was your largest challenges?
Yeah, so hi everyone. So this question is a little bit difficult for me because so I was diagnosed. My first diagnosed was in 2001, but after that I had 3 relapses through my childhood. So my whole childhood I lived with this with cancer. So for me it's like the most difficult thing was to like live my whole childhood as a patient. I mean, going back and forwards from hospitals, the checkups, every time I got sick, like there was all my childhood, it was this fear in my mind that cancer was, I mean, sorry, I'm a little bit nervous.
That's quite all right.
Yeah.
Pablo. Take your time. That's fine.
Yeah. What I'm trying to say is that through my whole life, I've been living with this fear of cancer coming back, because so I already had cancer 4 times in my childhood. So what's coming up next for my life? I mean, for me, living with that thought in my mind has been the most difficult thing, I think, in my whole life. Also that I had the lucky for me, I was living in another country in my first when I first got the diagnosis. So for my parents and for me, it was also very difficult to live in another country, like lonely, because all our families, friends, siblings were in Chile, but we were living in United States. So it was very difficult for us, like leave all behind, and we didn't know if we were gonna come back. I mean, that was also very difficult. So I think that was the most difficult thing I had to be through my life, and it's always going to be in my mind, like living with these thoughts of cancer coming back.
And Pablo, how does that affect your thinking about your future, as in terms of your job, your chances of a family, how you extend in the future? Is it always there, and does it stop you from thinking positive thoughts about your future?
Yeah, I mean, after a lot of therapy and conversations with my parents and a lot of thinking to myself, I've tried to live this experience like to grow up with it. I mean, get used to it, also make it like my purpose on life. I mean, I think for experience that I'm an expert in this thing, and so I decided to took this, all I learned, all I lived, to give my life to help people that are living the same thing that I lived when I was a kid. So I'm currently studying psychology, and I want to work with families and patients that are living what I lived when I was a kid. So I'm trying to make this the cancer, I want to make it like part of my whole life, but trying to see it as something positive instead of something negative.
Fantastic. Pablo, thank you so much, and thank you for being so open with us and sharing that experience. Now, I'm looking at my screen. I think we don't have Laudi with us, which is really unfortunate. She is a sibling, but I know she's been having connection troubles. But right now,
she's here.
Is she here?
She's here.
Ah, Laudi's here. Okay, I've been doing things timing without seeing her on my screen. Laudi, I will come to you in a second, but right now I'd like to turn to Ifani. As a parent of a child survivor, Ifani, welcome. I wonder if you could talk us through the challenges that you face as a parent of a child survivor of cancer.
Good afternoon, everyone. I bring you greetings from Lagos, Nigeria. First, I must appreciate the organizer of this event
and also the management of Childhood Cancer International for the privilege given to us to share our stories on childhood cancer survivorship. Honestly, I will start by saying that the worst place on earth to be diagnosed of cancer is in Africa. In Africa, you diagnose of cancer, you are strictly on your own. You are strictly on your own. Nobody cares about you. The government doesn't care. All you need to do from the treatment, from the beginning to the end, you are strictly on your own. One of the major challenges I faced was fear of survival. When my son was diagnosed of retinoblastoma, March 29, 2018, it was a difficult one for the family. I wept and I almost lost my life. But on the long run, we were able to stand right and all that. God helping us, we faced it gradually. And another thing I also have as a challenge is poor healthcare. In Nigeria, as at that time, it was only in University of Lagos Teaching Hospital, LUT, that you could be given fair treatment on cancer. So we struggled there. He went through the surgery. We started with surgeries. Shortly after that, he went through 6 stages of chemotherapy. Unfortunately, he was to embark on the radiotherapy, but there was no radiotherapy center in the whole of Lagos. We have to move down to National Hospital, Abuja, where there was no bed space made available for him. I have to lodge him in the hotel for 3 months for him to undergo radiotherapy, where he had about 36 exposures of radiotherapy over there in National Hospital in Abuja. It wasn't just an easy one, but as at the end of the surgery, one of his eyes was removed. We thank God it was still on stage 1. In stage 1, they removed one of his eyes. He's left today with just one eye. We still have fear because most times he's scheduled for checkups. Unfortunately, most of these hospitals are on strike. For over 6 months, you will be waiting for health workers to call off strike for you to go back to the hospital, for you to undergo another screening. All of a sudden, you hear again another strike is looming. These are the major challenges we faced and we are still facing as at now. Then we also look at issues affecting the cost of drugs. The cost of drugs, you get drugs today, the next time you are getting another drug, you discover that it's almost ×2 with the high rate of inflation in the country. But we thank God for the Doctors Cancer Foundation. We came across them over there in Lut. We saw their banners. Any child suffering from cancer should call upon them for assistance. So we just gave it a try, and to God be the glory, they were there to assist us. They assisted us from the drugs, right from the surgery, down to the chemotherapy stage, and down to the radiotherapy stage. And all these bills were being paid by the Doctors Cancer Foundation from the point that we met them. My prayer is today, if we have more of that of Doctors Cancer Foundation in Nigeria, I think the rate at which children die of cancer will be drastically reduced. As I this morning while I was coming down here, you get to a popular place called Mile 2, you see children. Many of them have the symptoms like that of my son. You see eye bugging out, no treatment, nothing. The government doesn't care about them, as I said earlier. They are just on the street begging for arms for them to survive, pending when they give up the ghost.
Fanny, sorry, Fanny, if I could just jump in a second, I wanted to ask. I mean, those are quite, they're very personal and focused on where you are, but I hear some themes there about how frustrating and scary it must be to be a parent fighting to get care for your children? I'm sure the people who have joined us are from many places in the world, and levels of care will be very, very different. So talking kind of universally, how does it feel when you face those things where you have to struggle for care and when you have to fight for your child as a parent? Could you tell us a little bit about how that feels?
Thank you. Thank you. It's actually devastating. First and foremost, the fear of continuous spread comes to mind as a parent. The fear of losing the other eye come to mind as a parent. The fear of other siblings having the same thing comes to mind as a parent. And now you get to know that one has been diagnosed of cancer. How am I sure that there will be no spread later in the future? Most times I see him having inches on his eye. As a parent, I become nervous. I quickly call Perfect. What is happening? Are you having pain on your eyes? The next thing he will tell you, Daddy, yes, I'm having pain. I could remember 3 days ago, I came back from work. I saw him just trying to take care of his eyes. I asked him, what's your problem? He says having pain in his eyes. I said, okay, don't worry. We get something to apply on the eye and all that. So there are a whole lot of challenges as a parent, because you risk the fear of you losing your job. You risk the fear of losing your child. You risk the fear of being engaged in accident for traveling for several thousands of kilometers, looking for solution to a problem. And my advice to people who are currently battling with this is they shouldn't lose hope. They should take their medication seriously. Whenever somebody informs them that nobody survived cancer, they should let them know that no, it's not possible. People are still surviving cancer. No matter how it is, people are still surviving cancer. We have been to oncology ward on several locations to give hope to dying children, to make them know that, see, it is possible. You could come out from this. It is possible. You will survive this. So by the time they hear our story, I met a lady recently, and I made her to understand that my son survived cancer. He said, really, can I see that your son? Yes, I said, this is perfect, my son. How did you do it? So I gave her some hope. They said for their child, they've lost hope. I said, no, you can't just lose hope because God is in control. You can't lose hope. I remember for the past 3 years, we have been to lose about 5 times to give hope to the hopeless.
Fantastic.
Fantastic. To make them understand that there is life after cancer.
Thank
to make
you,
them
Ivani.
understand.
Thank you. Ivani, let me cut in. We'll come back to that message towards the end. Thank you, Ivani. And I think that's a strong message about what it's like to be a parent of a child and how that affects people. You know, we focus on the child, obviously, but the damage and the impacts on people around them. And as a parent, you want the best for your child, and every parent will give their life for their child. And when that power is taken away from you, it's a very tough journey. I have had Laudi waiting for some time. I still can't see her on my screen, but I'm going to come to Laudi now if she's there. Laudi, are you there with us? We'll just give her a second.
Matt, I have a question from the chat while we wait.
Yeah, certainly. Let's try that up and see if we can.
Okay, I think this is a very interesting question, and she says, it's Lilian Delgado asking, what event, if any, and she's asking to the survivors, would say make a critical difference in your family's coping with your diagnosis? I understand that some of you were young, but if maybe that both of you who were older when they were diagnosed, Sydney or Pablo, you can share what do you think that helped your families to cope with your own diagnosis?
Okay, so our question is, let me just hear, because I'm not sure I caught it quite right. So the question is for the survivors, what was the most important thing that helped the families adjust and deal with the situation? Is that correct?
Yes, that's what Lilian Delgado is asking.
All right, so let me bring that question now and take it through. So Tiago, would you like to come back on that first?
So I think for my family, the cancer disease impact has made all the elements stronger, and until today. And I think what it helps in the situation when I had the cancer, it was the help of the other parents that were in the hospital, in the ward. That, for example, a little bit example I can share with you is that when a parent needed to go to dinner or to lunch, the other parents will stay with the kids until they come back. Nowadays, with the help of the parents' organizations and also with the survivors engagement with these parents' organizations, we can now have volunteers that are in these wards, in these childhood cancer wards, in the hospital, that do this job, and we have also parents doing this as well. But yeah, I think it was this. Yeah.
Thank you, Tiago. That's fantastic. So, Preeta, may I ask you? And I noted in your story earlier, you said you were so young that you were less aware of your cancer journey until later. I mean,
I heard a lot from my parents. They told me all the stuff back then.
Yeah. So they were kind of doing it almost without you knowing, without you being engaged in
yeah,
that.
Yeah, and because perhaps one the first the help that really helped my parents back then is the help for my big family, because luckily my family is a very big family.
Yeah.
And we're very supportive of each other, and that was very, very helpful. So I have one older sister and one older brother. So when my parents needed to take care of me, my aunt or my uncle would take care of my sister and brother. So that's the kind of support that my parents got back then. And also, same as Tiago, the parents of other survivors. Because yeah, that feeling when you know someone that is going through the same thing as you, it really helps you to go through all of the process, to ease your difficulties. Yeah, I think those two words that
are the key. So, Preeta, thank you. Thank you so much. Yeah, Sydney, same question to you, really, in terms of your family and those around you. What was key for them to get through it with you?
Thank you, Matt. I think one thing I did, I have 5 sisters and I'm the last born. I'm the only boy. And one thing I did was decide, when I got my diagnosis, I was with my dad and I saw him balancing some tears, and I'm like, if he's like this, how are they gonna, what's gonna happen to my sisters and my mom?
Yeah.
And at that moment I said, I'm just gonna be strong, even if not for myself, I'm gonna be strong for them. So I always try to put off a stronger version of myself, which is a good thing and a bad thing. But at the same time, my family was very supportive. And I also decided I wasn't going to keep these things inside me. So I talked a lot to them. I explained what was going on. We had discussions about how was I feeling, how we were going to get through this. We talked to other people, religious leaders, uncles, other people, and just, talk through the journey. And that really helped me, because it kind of helps you to unload everything that's, weighing heavily on you. And I think psychosocial support is very important. And I wish we could get to a point where, I remember in the 90s when, HIV and AIDS was big. And at the point of diagnosis, you were sitting in with a doctor and a counselor. And as soon as you got the diagnosis, the counselor would take you outside and tell you, this is what to expect, this is what you do. And these are some of the things we do for the families that we support at Hope for Cancer Kids, because it's a very traumatic experience. So I just wish we would get to a point where, from the point of diagnosis, you are either put in touch with a support group or another family that's gone through a similar type of cancer, or you're given a trained clinical psychologist just to walk you through the journey at a cost that you don't have to go out of pocket for.
I mean, that's a common theme that we're seeing. And of course, the reason that most of us are gathered here today is that knowing you're not alone, that there are support and people out there. But Sydney, I wanted to ask you about that sense that you may be a burden, and that you had to be stronger despite you having the disease. Do you feel that that's common as well for people of all ages, that you have to be stronger for people around you? It seems the inverse of what should happen, but is that a common experience, do you think?
I think it's a common experience, but especially for me at the age of 19, you know, you're just, you know, starting out life. You think now you're becoming a man, you have so many hopes and dreams and all these things going on. And this thing has just come and, you know, taken your world apart. But at the same time, I can't remember who said it, that they felt very babied and protected. I think it was Saprita who said that she felt like she was overprotected by a family. Like, I stand up to get a glass of water, and you see people rushing to the kitchen and, no, I'll get it. And at that point, you want to be treated like a normal person. You just want to be treated like, you know, just I'm okay. I'm not dying yet.
But we saw that that came out earlier, didn't it? People pull away from you. They don't know how to talk to you. You become more isolated. You have to be stronger, and then people treat you as if you're made of glass. And
Yes, exactly. So I think it is a common problem of having that feeling and that sense. But at the end of the day, as I said, it all comes back to the mental side of things. I wasn't doing it not to share my story. I wasn't not being weak just so that they wouldn't baby me, but it also helped me psychologically to say, you know, I'm going to beat this. You know, this thing doesn't have anything on me. And I just kept having that those recurring thoughts in my mind. So I guess also for me, it was kind of therapeutic to have that mindset.
Wow, that's fantastic. Thank you, Sydney. Pablo, if I can come to you. So the question is, from your perspective, the biggest challenges for you?
The biggest challenges for me or for my...
For those around you and your networks, just everything that this has brought you. What do you think the biggest challenges were?
So for me, in my case, I think the biggest challenge was to move to another country. I mean, back and forward, because I'm from Chile, but I was treated in the United States. So going back and forward to United States, Chile, it was a very difficult process. And as I said before, I lived with this my whole childhood. So it was a lot of times. I mean, going back and forward, like leaving my friends, families, my brothers, even my brothers had to stay here, and I had to go to the United States, not knowing if I will come back or how long I would stay there. I think that was the most difficult thing.
What was the cause of that travel, Pablo? Was it for treatment and for other stuff that you were having to keep going back?
Yeah, the checkups.
Wow.
Yeah.
Was that not available in Chile then? I mean,
yeah, but because the risks and the amount of like times I got sick, it was better for me, for my family, to travel to the United States, because in Chile, it's the quality, it's not as good as there. And lucky for us, we had the opportunity to go to the US, but for most of the people, they don't have that. So that's a huge also problem, I think, not for me, but for Chile and other countries in the world. And
sorry, Pablo, carry on.
No, that's
okay. Thank you so much. If Fanny, we've kind of talked about this. I want to come back to you a little bit. So you've talked about huge challenges as a parent. What kind of resource did you draw on? What was it that got you through? You talked about how challenging it was to get your son the treatment you required. What was the most significant impact on you?
Thank you again for that question. The most difficult challenge we faced then was fear of losing my son and the risk of other children we left behind. I almost lost my last son while I was away in Abuja. He had running temperature, and as a result, we almost lost him, but to God be the glory. Now we are looking at the side effects That is my greatest challenge as at now. As at now, my greatest challenge is we are yet to know the side effect of the chemotherapies that this young boy took at age 3. We are yet to know the side effect of the radiotherapies, exposures on radiotherapies. It's still a big challenge to me, even as I speak to you right now, because sometimes I try to find out what are the effects, because I get to know from internet that the chemotherapy drugs goes into the system and cause a whole lot of havoc, even when it has its own advantages as well. Yeah. But I begin to find out, I begin to also study further. He was 3 when these things happened. He's currently 7. Yeah. What happened at the puberty stage? Just as the doctor lady from, I think from India, talked about. At puberty, what am I expecting the worst? At puberty, what will I get to know about him? Is there screening centers where I could get all these things done now before then? So these are my fears, even up to this moment. And I will be willing to get guidelines from experts like you. Thank you.
Thank you, Ifeanyi. That's wonderful. As always, we don't have enough time for such a fabulous discussion, and I'm keeping a weather eye on my clock. We talked about 3 questions today, and we were going to ask about positive experiences, but I'm kind of going to blend that into the last question because I can see time and we need to leave space a little bit at the end.
Excuse me, Matt, can I just jump in for 1 second?
Of course you can, absolutely.
We have a question from somebody in the Chinese thread, and Benson has kindly translated it. It says, my daughter has leukemia when she was 3 years old. Now she is 6. I don't know if I should tell her that she has this disease. If I tell her, will it affect her? She is not worrying of anything at the moment. Do you want to give a chance? I don't know if you want the survivors to answer, if you'd like Dr. Pernilla to just say a couple words and then maybe switch it back to the survivors.
Yeah, let's hear from Dr. Pernilla in the first instance.
For this very important question, I think this is something that a lot of families consider, and I think there's not a big hurry in telling a young child, but I think it's good to have the conversation in small bits and pieces along the way, because I think it's relevant as an adolescent and adult to have the knowledge, and then waiting until you're an adult can be quite a shock, I think. So maybe I think it always depends on the individual family situation and the child, of course, but maybe having the conversation in small bits and pieces from their 6 years old, telling about that when you were younger, you had a disease, maybe not going into detail, and then the details can come along over the years when the child also start asking questions. So it becomes sort of more a natural part of the family history. That would be one advice, but of course, all families are different.
Thank you, Dr. Pernilla. That's really, really good of you to come back on that. We really appreciate it. So what I'd like to ask the panelists, the survivors, to do now is to have a think about that as well, about how families should talk to young children about it. The final question really wraps up. We've got about, our section here has got about another 5-6 minutes. So I'm just going to come to each of you quickly. What I'd like you to do is just say what's your keenest piece of advice, and you can wrap up what the doctor said into that. What advice would you give either your young self or other people out there who are facing this incredible challenge that you have all faced in your life? What did you want to know? What might have been useful if you'd known it at the start? So I'm going to come round to Tiago again. Tiago, that question comes to you, really. What's your sagest advice, sir?
So I would say that you can look for more information, to have more information about your disease, along with your doctors as well, along with other patients, along with other survivors and patient organizations, because sometimes they can have some materials that are adequate to some ages to tell about certain disease, certain cancer types as well. And they have the support most of the time the parents, to the children, to the young adults, and they can propose and give you some information and some health literacy materials that will be good. So engage with these people, engage with the patients, the survivors, and other families, and share your story as well. Yeah.
Thank you, Tiago. That's wonderful. Saprita, coming to you for the same question. What's your sagest advice and that you have for us?
Yeah, I think in principle, same as Tiago, the most efficient way to solve solve this, I think, is to go to the community, to the survivors community and the parents community, and ask for their advice, especially for this specific disease, and for the survivor to also be engaged with other survivors, so she or he would know that others are survived too, and they can live just like other normal people. And so by the time that the survivor knew that she had cancer, she would she wouldn't be so scared, you know. I mean, she's not alone. That's the, I think that's
not
the important point, that she's
not being alone and connecting with others. Yeah. Sydney, if I can come to you again, always with my eye on the clock.
What I want to say first is that cancer is not a death sentence. A lot of the time we hear so many stories about, negative stories about cancer, and this person died and this happened. And I'm not saying that those stories are not important, but there is a positive aspect to it. There are thousands and thousands of cancer survivors. Every year we have more and more cancer survivors. As time goes on, I'm speaking to you from Memphis, and I came for the 60th anniversary of St. Jude's Global Alliance, of St. Jude's Children's Research Hospital. And there's so much that's being done. The medications that are being made are less toxic. The procedures are less invasive. The treatment options are getting better and better. And we're moving closer towards that goal of finding this cure for cancer. It's still going to take some time, but I'm still here. That's one of the positive outcomes. I'm alive and I'm thriving. I'm not, going through life, with this, big thing on my shoulders, but I'm here, and I wouldn't say I'm normal, but I wouldn't be who I am if I hadn't gone through cancer. I'm resilient, and I'm using that experience to help others who are going through something similar, that what I went through. Organizations like CCI and SIOP working towards the WHO goal of increasing childhood cancer survivorship to 60% globally by 2030. Yeah. There are things that are being done, and there's a lot of information out there. There are websites, so many websites out there, and I think they'll be shared later, like Together, the Together website. And there's so much information. We live in a world of, this digital world where it's very easy to get overwhelmed with what's coming in, but there are certain places that you can go and get help. You can go and read about what you're going through. There are support groups. There are people out there who've gone through something similar to what you went through. So what I want to leave you with is there is life after cancer, and you can have a wonderful life, and you can thrive after going through, this devastating disease. So thank you for that.
Thank you, Sydney. That's a wonderful message of hope. I really appreciate that. Pablo, to you, the same question. What would you like to say to people?
No, first of all, can I add something about what I think Julia told earlier?
Of course.
About someone that asked a question about how telling your son or I want to say from my experience that telling the truth is always the best thing to do. I mean, for me, my mom and my dad always told me the truth, because I think the main, the best way to live this process of the cancer is love, and love has to be related with the truth. I mean, it also helps the patient live this process and understand what's going on.
Uh-huh.
I mean, I remember all my parents asked that. I remember asking my parents, like, is this gonna hurt? And always my parents, yes, it's gonna hurt, but it's gonna help you. It's for you to get better. Or is it gonna be too long? Yeah, it's gonna be long, but it's like important, like trying to make the child, even though if they're young, it's important for them to understanding from the beginning what's going on.
Uh-huh. Yeah.
Because in the future, maybe it's important, like, for their future to understand everything.
Yeah.
And so for me, in my case, it was very good, and it was better for me always telling me the truth of what's going on. Of course, with some in a way, in a easy way for me to understand, but telling the truth was always the main thing, to live this process with love and union.
Pablo, that's a strong message. Thank you. I appreciate it.
I just wanted to add that. And what was the other question? Sorry.
Just your best advice, which I think you just gave, but you can add to it. Yeah, live with love and truth.
And I want to say, it's gonna sound a little bit hard, but what doesn't kill you makes you stronger. So, like, take the opportunity, the experience you lived, I mean, as a patient, and make it something to give a sense to your life. I mean, for your future, to help you, like, develop as a person. So giving is like meaning, that's the word, meaning for your life. Yeah, it's gonna be hard, it's gonna be difficult. I mean, it's gonna be a lot of psychological difficulties. I mean, but learning from the experience, taking it as a good thing, as a positive way to living your life.
Pablo, thank you. Thank you. That's incredibly powerful testimony, and I really appreciate that. That is wonderful. I'm just sorry to cut in because I can see the clock in my bottom right, and I know we need to move to wrap up now. It's a terrible shame because we should be able to do everything. Ifani, you have the last 1 minute. What is your greatest advice to parents who are facing their children with suffering from cancer?
Thank you. My advice to them is that survivorship is possible.
Yeah.
Survivorship is possible. But it's not at all times you think that as soon as you are diagnosed of cancer, that death is the next option. No, 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 no. Be courageous. Take your medications seriously. Visit your physician on appointment as scheduled, and I think you will come out of it. We visit hospitals giving hope to those who are battling with it right now. Thank you.
Thank you, Ifani. That is a wonderful way to finish up. Again, I hate to stop this because I think we could probably do another hour, many more. And I know that the message of hope and experience that people are dropping in to hear about is very powerful. So it's been my humble pleasure and privilege to work with you today, everybody. But I need to hand back now to Jao, I think, who is going to wrap up and take us out of it. Jao, can I call on you, please?
Yes, Matt, thank you very much. Well, I think this is one of the most powerful sessions with survivors, parent, unfortunate but not the sibling I have attended in many, many years, and thank you for that, and thank you for your fantastic moderation, Matt. Thank you very much. So
no,
I would like to...
Mine's the easy part, Jao. Do excuse me, but
no.
Bit.
It was a very powerful moderation, and thank you for that,
thank
Matt.
You. No,
so I would like to invite you now to listen to Kathy Pritchard-Jones, the president of SIOP, before I wrap up. Can you please put Kathy's video? Thank you.
Hello. I hope you've enjoyed and taken home some useful learning from this webinar today, which is our second advocacy webinar for International Childhood Cancer Survivors Week, organised jointly between SIOP, CCI and St Jude. As SIOP president, I'd like to thank all the healthcare professional speakers who shared their work and showed their dedication to survivors around the world. Also the cancer survivors, the father and sibling, who shared their personal stories so movingly. Our goal is to show that life after treatment for childhood cancer can be full of accomplishments and successes. Nevertheless, we recognise that physical and mental health issues may arise, and we hope that the presentations today have been informative and helpful to you all. Together with our partners, we plan to mark International Childhood Cancer Survivors Week in a similar way next year. We therefore welcome your feedback on today's event to help us make this future endeavour most useful to you all. Thanks again for joining and listening.
So, thank you, Katie. I presume she had to leave, but now this webinar has come to its end. It was a privilege for me, quite honest, it was a privilege for me to have co-hosted it. But before saying goodbye, I would like to acknowledge some important collaborations without which this would be impossible. The SIOP team, our close partner in the organization of this webinar and other events. The St. Jude team for their precious competence and dedication. The translators for allowing us to reach the Latin America and Chinese communities. Those who helped us financially or creatively. The health professionals and moderators for their expertise and availability. Last but not the least, the survivor's parent and even sibling for the important and very powerful testimonies, and so that everyone that attended this webinar saw that wherever you are in the world, we face similar issues. This webinar was recorded and will be available shortly. We will keep you updated on that and other initiatives. I think this one strong evidence of this webinar is the huge and unfair disparities around the world. And all the community are focused, as Sydney mentioned, on achieving a 60% global survivorship. That is our goal for the next 10 years, and we must not fail it. Thank you for attending this webinar. We will keep you updated with other projects and have a nice rest of the weekend. Thank you very, very much to everyone.